Welcome back. Well, many people are confused about the upcoming changes in healthcare reform.
And confusion's the perfect opportunity, unfortunately, for scammers to take advantage of you. So here to help avoid getting taken for a ride is consumer advocate and today's TMJ4 Call for Action Director, Karen Stiles, who we haven't seen in a while. Great to have you back on the show.
Well, thank you for having me.
Yeah, the thing I always think about, like healthcare reform in this year in 2014, as we look ahead, is it's confusing. You know, it's like it's hard for people to get the information they need in an understandable way.
Right. A lot of things are not going to change too much for people who have group insurance, Medicare, or other insurance in place already. But you could do a 24-hour telethon on everything else that is going to be happening with this.
Okay, so what kind of changes are we going to see and who's affected?
Okay, some of the things that you will see is that if you are uninsured and it's because you've had pre-existing conditions that have prevented you from getting coverage, you're now going to be able to do that.
Any age?
Any age.
That's good news for a lot of people who want insurance.
Yes, it definitely is. There are also going to be subsidies to help people who would have a hard time affording this to be able to afford it. So some very good things coming out of it. But there's also going to be, you know, some other changes that, you know, like will happen with any plan from year to year that we're all going to have to get used to.
Give me an example of something that's maybe a con as we look toward changes in healthcare.
Okay, what you may find is that you may have a higher deductible than what you had before. That's possible.
Yeah, raise your hand if your deductible's lower.
Yeah, right.
No hands. Right.
If you weren't paying for health insurance before because it was too expensive, you may face a penalty now if you don't pick up some kind of health insurance coverage, all depending on your income, of course.
Okay.
So those are a couple things that we're going to have to get used to, and maybe some higher taxes as well if your income is over $200,000 for an individual, $250,000 for a couple.
Oh, that's tough.
Yeah, right, exactly. I'm a couple. Thanks for reminding me. No. I'm just kidding. So there's different groups of people, whether it's socioeconomic or is there age or gender issues that are specifically affected as well with certain changes?
If you are already covered by some type of government insurance like Medicare, Medicaid, you're probably going to stay on that. So that's probably not going to affect things. It's kind of done so that it levels the playing field, that some people will not see any change in their premium, some will see an increase, some will see a decrease. It just kind of is, that's one of those things that's going to be ironed out yet.
And what makes this situation when we face healthcare changes or reform, what makes it kind of ripe for people who could take advantage of people?
Anytime there's something new going on, scam artists are right on it. The biggest thing that we need to make sure that people pay attention to is nobody is going to call you, okay, and ask you information or offer. Nobody is going to call you, okay? So watch for stuff that's going to come in the mail. Watch for stuff that is going to come from your employer. But even if it does come via mail, be careful to make sure that it is coming from a legitimate source.
Okay. And how can you do that?
Contact the various websites, like healthcare.gov is the central for a lot of this. Wisconsin Insurance Commissioner's Office will be able to answer questions.
OCI, and we have it at the bottom of your screen there, oci.wi.gov. And the next one you're going to mention is the Kaiser Family Foundation, KFF.org. And all of these are on the Morning Blend website, as well as people can check out the Call for Action site, too.
Right, absolutely.
So these are places to go to check that the information you're getting is legit.
Yep, and it's also, these sites can be very helpful in giving you an easy to understand method of what's going to happen with this whole plan. All right, so to give you some, you know, further information of what to expect.
Here's where you call from 11 to 1 right now. Call for action at 414-967-5495 for questions, scams, questions. Call for action at tmj4.com is the website, and you can rewatch this on themorningblend.com as well. Thanks, Karen.
Thanks, Karen.
You bet.